Hi friends, today we are going to learn what to write for the answer called as pulmonary embolism if it is given in surgery question paper. Actually, first, clot embolism. Embolism is a clot which is traveling in the blood vessel. Basically, it is a detached clot which is traveling in the blood vessel is an embolism. Risk factors for the embolism or pulmonary embolism are post-operative and traumatic patients who are bedridden, pregnant women, old age, obesity and heart disease, varicose veins, deep vein etiologies, carcinomas. Pulmonary embolism is due to deep vein thrombosis. Deep vein thrombosis, a thrombosis from the deep veins which are basically femoropopliteal or iliofemoral region, which detaches the clot, which detaches and lodges in the lungs, in pulmonary arteries or capillaries, resulting in failure to exchange of the gases. Deep vein thrombosis is caused by Virchow's triad, which is due to the triad is slow blood flow or stasis, which results in formation of clot, or damage to the blood vessels, which may result in formation of clot, and hypercoagulability. All these three results in formation of clot, and this clot forms an emboli, gets detached. It's detached from the blood vessels, forms an emboli and lodges in the lungs. Types. There are three types, which are small emboli, medium emboli and large emboli. Small emboli causes pulmonary hypertension. Medium emboli lodges in the pulmonary arteries and result in the chest pain and results in hemoptysis and dyspnea. Large emboli, which blocks the bifurcation of pulmonary artery trunk, which results in severe chest pain, dyspnea. Dyspnea is due to failure of exchange of gases, shock and raised venous pressure and may lead to sudden death. Effects of pulmonary embolism are decreased cardiac output due to decreased venous return. Due to blockage, there is decreased venous return and decreased cardiac output. Pulmonary vasospasm and pulmonary hypertension. Bronchospasm and defective oxygen in the blood. Now let us see the clinical features. Clinical features are dyspnea, chest pain, hemoptysis, tachycardia, tachypnea, cyanosis, pleural rub and cardiac gallop. Gallop is the rhythm of horse running. The sound which produced when horse run is called as gallop. So we can listen cardiac gallop. Next is investigation. Investigation are chest x-ray, hyperlucency in the area of oligemia, which is called as Westermann's sign. What this is called as Westermann's sign, which is seen in pulmonary embolism cases. Next we have to go for CT and MRI, pulmonary angiography to see the condition of blood vessels, arterial blood gas analysis, and isotope radionucleotide ventilation, Doppler study and venography to rule out deep vein thrombosis. If we come to management, thrombolytics are given, pulmonary embolectomy is done, venous thrombosis is done, ventilator support is given, filters are placed in the vein, and treatment of DVT. Thrombolytics such as streptokinase. Initially it started with 6 lakh international units per hour, later it is tapered to 1 lakh international units per hour. Pulmonary embolectomy, immediate thoracotomy is done and pulmonary embolus is removed. Next, venous thrombectomy by Forget's catheter. Venous thrombectomy is done by Forgetty catheter and ventilator support is given. Next, filters are placed in the vein. To prevent further emboli, filters are placed in the vein to prevent the clot to travel through into the lungs. Next, treatment of DVT is given, and this is the answer to be written for pulmonary embolism.